So I saw this girl in the office a couple of days ago, and she's in her mid-20s, and she starts telling me the story about how her kneecap has been dislocating since she was in middle school. So she's had 8, 9, 10 dislocations, and she's always been told to just have physical therapy.
I also saw a patient in the office this week who first dislocated his patella playing football, direct contact to his patella. And those are kind of two different kinds of patients. There's the patients where it didn't take much force to get it out in the first place, and they have a lot of risk factors. And then there's the patient where
it's an acute traumatic event that may not happen again. So historically, I think orthopedics has poo-pooed these patellar dislocations a little bit and said, oh, just go away into PT. Or she was actually told by a treating physician years ago to just not be active. That's of course not the right answer for someone in their teenage years.
So part of that reason was there weren't great operations for patellar instability. So we've only been doing medial patellofemoral ligament reconstructions for about 15 years. It wasn't an operation that I even did when I was doing my training. And so now that we have better operations for this problem, I think we should be treating a lot of these patients much earlier.
Yeah, I think the field overall, and I would say especially the two of us, have gotten a lot more, and aggressive is the wrong word, because what you end up doing is you're preventing additional injury from happening. So maybe it sounds aggressive to recommend surgery after 1 or 2 dislocations, but if that helps for the next 30 or 40 years, I wouldn't call that aggressive.
So the MPFL surgery is a small scar on the front of the knee and another small scar on the inside part of the knee, and we typically use a donor graft, attach it to the kneecap, attach it to the femur, and in the recovery, we're essentially waiting for the patient to regain their strength and grow into that graft.
Yeah, and everyone knows about ACL reconstruction. It's kind of a similar concept. You reconnect two bones so that they don't move relative to each other.